Hello?
Hello?
Hi, this is Shauna. Is this Kaylin?
Hi, Shauna. Kaylin, how are you?
Good.
We're having some technical difficulties, so we'll get started here shortly.
Okay, yeah, trying to join, I can see the PowerPoint, but I can't, it's not letting me join. When I tried to join, it said it was over.
You know, I had that same issue. So we're having some technical problems. So hopefully we'll get it up and running. So, and we might just end up starting without the PowerPoint and then just have you progress the slides.
Kaylin, can you see the PowerPoint now?
Is that you, Stephanie?
Yeah, can you see the PowerPoint now?
Shauna?
Yes?
Can you see the PowerPoint now?
I can see it. I just have this box trying to join the meeting. Let me see if I okay it. Okay, I can see it fine.
Okay, awesome. Stephanie, are we ready?
I think so.
Do you want me to start, or do you want to go ahead?
Are you talking to me, Kaylin?
Yeah.
Okay, perfect. Let's just go ahead and start. I think I've figured it out. So welcome to the webinar. We have Judy Harris that's going to present to us today. She will have some participation pieces throughout, and so make sure you are paying attention, and we'll kind of bounce around as we go. So I'll just turn it over to Judy. Oh,
Hi
and
there.
also, let me just interject 1 second. Make sure you guys are on mute in the meantime until you're asked for participation. Okay, go ahead, Judy.
Okay, hi. Thank you very much for coming. Can I ask, do we know how many's on the call here, guys? Stephanie, Kaylin? Can you tell how many we have? How many participants we have? Do you have any idea, Stephanie?
I will figure that out. I am not sure. And right now it says I have 16,
Okay.
but I don't know if people haven't been able to join quite yet. So.
Okay, that's great. Okay, just kind of gives me a sense of what we have out there. Okay, and then since it's like 2:15, I'll try to get this close to 3 as possible to not overdo it, and we'll see how that goes. So, again, thanks for your work in the community. It's such a valuable job you have, and I was asked to present on some counseling tips for healthy eating, and I hope this will add to your counseling and clinical toolbox. So thank you. I would like to get your input and some feedback and have you involved in some of this, even though it's a virtual environment. So if you would, we'll either have you text in a comment here or there or feedback, or drop your mute and just jump in. We'll be informal here. So next slide. I can't tell what to, I'm not going to let, that would be great if I could do that. Okay. So heart disease is a leading killer of men and women and claims more lives than all forms of cancer combined. So you know that information. It's we know it's a concern, so just really shocking. So I first wanted to ask you to write down on a piece of paper or on your tablet or something, on a scale of 1 to 10, to answer this question. Do you think you can make a difference in a person's life? If you think you can have impact on the people you counsel, is what I'm getting to. Okay, next slide. So, next slide, please. There you go. Thank you. So you've all seen these maps from the CDC. It's shocking data. So you already know this information, but 1 in 4 Utahns are obese. And we know that close to 35% of the U.S. adults are also obese. So we're looking at over 78.5 million people, and we're looking at a very, very expensive health care cost that goes into $150 billion a year or more. So again, this is information you know, but just trying to remember why we're here doing our job. Okay, next slide. So I'm going to go back and tell you a short story. I'm going back about 20 years when I started doing lactation counseling. And as a dietitian, I was trained in some areas, but in lactation, it was a little new arena for me. And so I was observing other healthcare providers and seeing how they were assisting moms with their babies and how they were counseling them. And so I saw these really great professionals talking to moms and doing full assessments, problem solving, and a lot of times it was about moms not being able to feed their baby enough milk or the babies weren't gaining enough milk. So I'm watching this interaction, and I'm observing the health professionals say things like, okay, so this is what you need to do. You need to nurse more often, you need to feed your baby more, you need to pump some more. So don't forget to make sure you fit in the breastfeeding as much as you can and get in, say, 4 pumpings during the day. So, you know, this sounds really good. It sounds competent, right? It's good information. They're caring people. But what do you think happened? Somebody drop their mute and tell me if they're getting any sense of where I'm going with this. Okay, I'm going to keep going, but I want to get somebody to respond here in a minute. So what I saw were these women coming out of the offices and not really getting a feel of what they need to do differently. They knew what the situation was, but I was finding these women were using infant formula. They were going back to using formula, so they really didn't get the results they needed. They really didn't get the information they needed that fit for them. So I want us to think about these situations when we're talking about healthcare topics. Can we improve in any of our aspects of our counseling? So you know about all these health topics, so you have the content, expertise. What I saw with the counselors were that they didn't know how to package the knowledge into a plan that would fit into their individualized needs. And so these women were walking out feeling like maybe it wasn't the best use of their time. And I really didn't want to feel that way. So I worked really hard at trying to figure out the content and then how I could package this. So during this presentation, I want you to think about all the great things you do and then what you can add to your toolkit as an educator. And you know, catch yourself when you think of moments where you say things like, okay, we just need to focus on a little more exercise here. We need to go further than that. So I want this to be a rewarding job for you always, and I find that when I dig in a little deeper and work with someone individualized in an individualized way, that it really makes a difference to me because I feel rewarded because I'm making a difference in someone else's life. So, okay, so somebody drop their mute and tell me an experience that they had with counseling like this. Whether you observed it or you've experienced it yourself with your own professional work. Come on, I don't want to pick people out. I know where you live. Yes? Come on.
I think that I've experienced this a lot where, I don't know, maybe we're on time crunches or whatever, where we have all the information and we're trying to give it to them, but it's a blanket terminology or blanket information. We're not giving them specific things that they could implement for themselves, and so they might not buy into what I'm giving them.
Excellent. That is, I couldn't have staged that better. That's exactly the crux of the issue. You're on a time crunch. You have a lot of work. You have people waiting. You're trying to get through all your work, and you run into these phrases work for me. So you use them repeatedly, and then it becomes more canned and less believable and less individualized. Great. Thank you so much. What was your name?
Oh, Stephanie.
Stephanie. That's Stephanie. That's your voice. Okay, great. Well, there you go. You know the system very well then. Okay. Okay, so next slide. So what I'm trying to get to is bring closer their need with your role. So counseling is an evolving practice. We get experience under our belt. We have more time to play with different people and our role. And so practice will make us better, hopefully, as we move through our career and become better counselors. So I'm asking you in that respect that you have a lot of talents, you have a lot of skills. I'm just asking for us to look at what our toolkit looks like and how can we look at some of these things. So individualized counseling is one of those key pieces to get away from that canned flavor of doing counseling. So because you're in this field of health promotion, I'm sure you've probably been called passionate at a time from time to time, or you have a lot of interest in helping other people, so that will really get you through this role, if you will. So looking at, are you going to be the person that's going to help this person in front of you? Is this going to be the moment in the program that's going to make a difference in their life? Does that make sense? Okay, so next slide. So the other aspect of this, besides the individualized piece of counseling, is the relationship. And I'm going to tell you another short story that kind of brings to this point. I have a coworker who has a mother that's 89 years old, and she wouldn't take her medications. So she took her mom to the doctor, the family practice physician, and the partner was the only one that was available, not her regular doctor. So this physician was really nice, and she told her all the things she needed to do. And after the appointment, you know, the daughter noticed after a couple of weeks that the mother didn't make any of these changes, and she had no intention of making any of these changes. Her condition got worse, so she goes back to the doctor, gets in with her regular care physician that she usually sees, and this physician went through the same amount of information in the same manner, was great. What do you think was different this time, and why? Now I want somebody other than Stephanie coming in and asking or telling me or telling the group what was different in this situation. Come on, we're not going to get through this. It's on the slide. I want to make sure you're paying attention. Guys?
Well, she felt cared about by her regular physician, so she was more willing to hear him out.
Great. And who is this?
Nicole Vernal.
Thank you. Thank you, Nicole. Excellent. Thank you. Exactly. She felt comfortable. There was a relationship established. And yeah, so things, what she trusted her because of that relationship. And so yes, she's going to be more compliant. And there's lots of data that show how physicians have impact in their role by making one or two sentences or statements to their patient. So as a health educator, you also have that clout, if you will, if you have the relationship established. Okay, next slide. Thank you. So we're going to talk about here, the next half hour, are some of these techniques that you can incorporate so that you're doing these techniques of individualized counseling and building that relationship or connection. And then I will also provide you with some resources that maybe you'll find useful and you can expand and play around with using, so you're not giving the same canned information. Or just change it up a little bit. So I'll give you some resources so that you can refer back to them when you're able to get through it, or you have time to get to it. So, okay, next slide. So this is what you're looking at. This is your data collection sheet that you have all these requirements that you have to fill out. It's only like one page of 4 pages that I could fit on this slide. So where do you start in a job like this, right? You have all these things to ask, all these check boxes. And we're great at doing that. We collect all this information and data, and where do you start as a launching point? So you just start asking these questions. You just start going through them. Okay, next slide. So really, the key is what I just had referred to is the connection must be there before the content is delivered. So these 2 pieces are very, very important if you want to be successful. So make a note of this yourself, connection before content. So next slide. this is what I want you to kind of think about. Put down that pencil. Start thinking about who's in front of you and start engaging with them. I do private consulting in the community as well as out of state with other organizations, and I've observed some of this, and particularly when I'm doing individual consults, I hear about other people that are out there, and sadly I heard about one peer of mine that was so involved in her timekeeping and in her laptop for documenting that she missed the connection, and I started to find that she didn't have the relationship established and was losing business because, you know, this is how she was moving. So, you know, just a really good thing to think about. Again, do you want your client to leave feeling they had a very valuable experience and it was worth their time as well? So next slide. Teddy Roosevelt said, "People don't care how much you know until they know how much you care." I'm sure you've heard that quote before, and I think it's just a great one. Women really need to feel safe before they are going to share their concerns or their personal information. So we're going to talk about something that's tangible. It's a technique or method that's really simple. It's easy to follow. Next slide. And I love it because it is so easy to use, but it's very, very effective, and it will build off of what we've been talking about, making the connection and individualizing your plan. So we're going to go over this briefly, and then I'm also going to give you some information that will expand on it in detail in just a one-page sheet that will kind of go through these steps in more depth so you can get a little bit better at it. So the first step is called, it addresses excuse me, hold on. Okay, so the first step is to ask open-ended questions. So think back on your opening statements when you talk with someone. What are your first statements that you say to them, and how open are they? You all know about what the difference is between open and closed-ended questions, correct? And so by opening this in that fashion, you're going to really seek your client's thoughts and feelings so that you're going to draw out more information, as opposed to a dead end where you get just a yes or no or a one-word answer. And the beauty about this is it really does prevent them from answering in a way that is right, quote unquote, or telling you what they think you want to hear. How many times have we seen that about a behavior that they are knowing is not the appropriate behavior, or smoking, or the amount of food they're eating, or whatever it is. So this avoids that whole aspect of it, and it builds a rapport that will help the woman feel confident and safe in sharing her concerns. So think about your conversation starters that you use, and a trick is to maybe write down some of those. In fact, what you could do right now is this is one of the exercises I'd like you to do, is write down one of your conversation starters that you use right now when you see someone. What do you say when someone comes into your office? And I know you're busy and you've got people coming in. Hi, how are you? Okay, that's not going to get enough information. That's okay to start out, but what are some of the other questions you ask, or do you just jump right into that questionnaire? And think about how you can modify that process. You can always go back to that questionnaire, but even during your questionnaire and gathering that information, you can pick a certain few areas and ask open-ended questions there. You may not be able to ask every question open-ended, of course, that would be too time-consuming, but the ones that you want to really target on and delve into, you could ask by using those starter words like what. What has been going on in your life lately? Or more specifically, what has been going on in your life relating to your eating habits? How? How's a great word. Or tell me more about that. You can focus in and direct the conversation, because you're going to get a lot of answers that are going to be very broad. So you might have to dig in, or what we call probe, into the areas that we want to direct them or redirect them, and keep them on track onto the subject matter we want to find out. So I would love for you to practice this at home with your spouse or your children tonight. Okay, it's a fun activity, and when I get through the rest of the steps, I'll show you what this means. But think about this as I'm talking to you, not only with your clients, but think about how you're going to do this with your with your spouse or significant other or friend or family member and see if you can pull this off. So you're going to ask open-ended questions before you do anything else. Okay. Second step, next slide please, is to affirm her feelings, or in this case tonight, one of your family members' feelings. So affirmation is the single most important thing you can do to help a woman feel safe and comfortable. Affirmation is a short, simple statement that lets a woman know her feelings are okay. Remember, affirmation acknowledges not what she says, but her feelings behind what she is saying. So you might need to read between the lines to really find out what the root of her concerns are. So same thing tonight. You go home, ask someone an open-ended question about their day. Okay, don't say, how was your day? That's not open-ended. And then make sure you affirm. Once your client or your family member, in this case, feelings are validated, she is more likely to hear the information you will share. This is really key, right? People want to talk and nobody wants to listen. We want you to be doing more listening and less talking and have this step be effective. Again, you will be more effective if she feels validated and affirmed in her feelings. So you could say things like, you were right in that, and blah, 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 blah. It can be very difficult, and you know, express that, yes, you've heard this before, and yes, you know, these are true feelings you have. Or I've heard people say that too, that blah, 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 blah. You know, so come up with some canned, if you will, responses so you can get that under your belt and you can feel comfortable about making these affirmations, and then you'll find it will become a more natural process for you. Okay, so counselor empathy, next slide please, is highly correlated with successful treatment outcome. So this step, including or adding to with empathy, really makes it a powerful tool for you to use. And people really need to feel good about their own power. They need to feel that they've been heard and understood and can take on these challenges. So this is not only a tool that will help you in your process, but it also is a tool that will help them in their process too. Next slide. So by supporting self-efficacy, which this refers to an individual's belief in her capacity to execute behaviors necessary to produce specific performance attainments. It reflects confidence in the ability to exert control over one's own motivation, behavior, and social environment. One's belief in one's ability to succeed in specific situations. So one sense of self-efficacy can play a major role in how that person approaches their goals, their tasks, and their challenges. So this all kind of ties into that empowerment. Okay, next slide. If I'd known I was going to live so long, I'd have taken care of myself better. Isn't that great? So that's what we're trying to think about too here. How do we care for good quality of life? Because our age is, I've got a 92-year-old mother. Okay, so next slide. Oh, we're behind one slide. Okay, there we go. Oh, I'm sorry, I skipped ahead. I'm sorry, I skipped ahead on that. Let's go back. There you go, we're good. We're on, I wanted to mention on three-step counseling, the last piece was education. So that's the area that you're already pro at. You know how to do that. So keep in mind the other two steps before you start providing that information. And I know as educators, as a dietitian, as a consultant, I constantly want to share the information I have, and I have really had to train myself to know that I'm not going to be as effective when I spit out all this great information that we're willing to share if I haven't asked the questions, let them feel heard, and affirm their feelings. So I think it'd be awesome if you could, send in a quick email to Stephanie tomorrow, or you can send it to me. I'd love to hear your feedback on how this works with your family at home, or if you feel like you can't quite do it and you have to, try again. Oh my goodness, I gave my opinion on their behavior at school before I had a chance to ask more questions and say, oh, that must have been interesting here, this and that, and affirm. So I'd love to hear that. Okay, so next slide. So following up on the clients, I don't know how much time you have to do this, but most successful programs really have a support piece in place, whether it's a group support or following up on calls. So again, I don't know what your workload can handle, but the key really is to build off the work that was done previously and to continue that progress, and ideally with the same counselor for a period of time, so there's that continuity. So, you know, let me ask, do you guys ever make follow-up calls?
I do.
Okay, that's great. How often do you do them? Do you wait a couple weeks, a month? What's your interval?
I'm pretty new to it, so I guess it depends on their risk factors, how many, but usually every 2 months probably.
Okay. Okay, that's awesome. Is this in Vernal too?
Yes.
Yeah, you're great. That's wonderful. And you being more remote, that really gives them a resource. How are they welcoming your calls so far?
If they know that they're coming, then they're pretty good about it.
Ah, that's great. Very, very good. So that they're not surprised, they're not put on the defensive, they might look forward to it. And if the experience is really positive, then they're going to look to you as a resource if they felt like they were heard and they're walking out of that session. That's great. That's really great. Good job.
Thanks.
So next slide before I jumped ahead, and I'll reread it. If I'd known I'd be going to live so long, I'd have taken better care of myself. And I just think that's that's so important. Okay. And next slide. I just wanted to ask questions. Does anyone have any thoughts about this so far? We're going to go into some nutrition resources.
Judy, I just have a comment. This is Stephanie again. We do provide follow-up with our patients, or our clients, I guess, but I think that one of the major problems that happens is it's hard to follow up with our clients just because we're following up by phone and they don't answer, they don't call us back or whatever. And so I think that's why it's so important to develop that relationship while they're there in person, because they would be more apt to be receptive to the follow-up. If they do miss your call, they might be more apt to call you back because they feel like they might have a relationship with you versus somebody that's just been giving them, you know, you need to exercise more and eat better. And they're like, okay, well, they'll follow up with me. I probably won't answer. I don't know. I just feel like people are going to be more receptive to those calls, especially if you're telling them, which you should be, that the follow-up is coming. But I think that the follow-up would be easier if they felt like there was more of a connection with their individual coach.
Great, Stephanie. Excellent, excellent points. So you're exactly right. People are going to resist the contact and the confrontation, if you will, if they feel like it's not been a warm experience, a positive experience, and they have not gained something from that experience. Think about anything that we do. Do we ever want to go back for customer service? If we go into a store or we go into a restaurant and we don't have the service we want, we're probably not going to go back shopping to that store or that restaurant if that experience wasn't a positive one. So making it individualized, building that rapport and having that connection, then they're going to have a sense that you really do care. And, you know, it probably will save you time in the long run because you're not going to be making all these random calls and not get through to anybody. That's got to be a very frustrating aspect of your job. Another thing that helps a lot, as you said, is preparing them for that call and say right up front, you know, we are a support system for you and we want you to value our services and we are here for you. And, you know, when you tell them that this is part of the program and you tell them that, you know, this is when you're going to call and make sure you, again, call during that time frame that you're able to. And ask them what is the most convenient time to call? What are your hours? What are the days? What are the times? You know, and make sure, you know, you get an appointment window so that they're expecting you and it's convenient to them and their lifestyle changes if something comes up. So those are all great things to do in advance. We have seen in Utah different support groups that have been very effective when they have done in-house support group meetings, and then from that they have been more successful in making phone calls for follow-up into these areas. So sometimes it takes a while for the grapevine to spread the word that you're a good counselor and that you're well-liked and you were actually helpful. But we do see that once that's in place and these pieces are there, that the program takes off. So, and again, it goes back to my first story that I really wasn't seeing the results of these moms coming out of these counseling sessions, and I wasn't seeing the results of them breastfeeding longer. Their duration rates were not extended. So what were the problems that were happening here? What was happening? And we have to catch ourselves to see if we're just telling them what to do rather than how to do it. Get into the real issue of how you can feasibly work with them rather than just saying, okay, exercise more. So we get into more of the logistics of their schedule, their individual needs, and we'll talk a little bit about this in a moment as we're going through some of these resources. So no one else has any questions, but let's go to the next slide. So, I'm sure you have lots of resources and tools. You're on your computers all the time. I'm sure you have great materials that you're using. So I'm just going to share a few of the different approaches that I've liked to use over the years. And then, like I said, I'll have some other materials that I'm going to pass on to Kaylin or Stephanie to pass out and to share. So next slide. So this is one. I'm sure you've used MyPlate or some of the materials that have replaced the MyPyramid, and I love them. They're very visual. They're a great way for anyone to look at how to incorporate portion sizes or the food groups, if you will, onto your plate. And it's not just for, it's originally, some of the MyPlate methods were working with diabetes patients for managing their food groups and their portions, but I love to do it. I love teaching this. It's a great, easy way. Half your plate is vegetables, and then the other half is divided up with your protein and your carbohydrates, and you can talk about what that means to that individual person. So I love that it's a reminder. You could actually take these materials and print them or have them as posters, or have them as handouts so that your moms, your women, these women, these grandmothers, whomever that you're seeing on a regular basis can have it on the refrigerator or somewhere in their kitchen posted, and it's a great reminder for them as well that this is what you talked about and that you were the person to have provided it to them. It will be a reminder to them of who you are and of your session, so that will keep the connection there as well. You could even put your phone number on there on the corner or something with your name. So next slide. I'll include this in some of the resources where you could print this and also share this with your coworkers, or remind yourself that you could bring a paper plate in and do the same technique. You don't need to have a fancy kit, but just have a paper plate and put down a placemat and a little plastic fork and spoon and knife, and let them feel like, okay, this is theirs. And you could do this as a hands-on technique right in the counseling session. So ask them, what did you eat yesterday? And they could take a pencil and draw in. You could have some colored pencils there, and they could draw in a piece of fish or a hot dog or whatever it is they ate. You could actually have paper models. You could cut out some models if you were motivated enough. There's plenty of things on the internet you could cut out with just a few different examples of each of these groups, with the non-starchy vegetables, the starch products, and then the protein, and let them kind of play around with putting the pieces of paper while you're collecting information and asking some of those questionnaire pieces. You could have them play around with this and put together a little plate, and then that would be a great discussion point. Some people might even be motivated to have food models. That would be really fun, but it's really pretty eye-opening to see what they do with this information. I did this at a presentation with one of our diabetes groups, and within just 2 or 3 minutes I could sort out exactly what people were struggling with, and it gave me a lot of information about how to move forward with each person. And it was fun for them. It gave them some time to talk and joke about things where they might not have disclosed things like, oh yeah, I eat this all the time, you know, and you know, here's the ice cream thing, and you know, so it was a really fun way of getting their involvement. So, okay, next slide. Something as simple as a poster on portion reminders. You can also use as a handout. I don't know if you have something like this, but these are just some things that might be helpful. You probably have seen the rule of thumb with the deck of cards or the cell phone, or the dice or the golf ball. All of these things are great reminders of portion control and how much you should be eating for a portion. And, well, you know, could be a tool when we're talking about how many servings we're having a day of different food groups. So, next slide. This is a diabetes resource. It's Choose Your Food label, or Choose Your Foods, and it's from the Academy of Nutrition and Dietetics. And there's some information on the Diabetic Exchange List out of Arkansas through their extension service. So there's lots of really great resources out here, and I think I have this publication I can include in the toolkit as well. So there's lots of things that you know maybe you haven't looked around recently, but jazz it up for yourself so you don't have the same materials over and over. That's part of the fun of being creative in your role as a counselor, is you can do different things. You don't have to do the same things all the time. Okay, next slide. Here are some more resources on carb counting from the American Diabetes Association, calorie trackers and apps, and then some fun things on recipe builders. So these are a few that I picked out that I thought they might be fun for you. Okay, next slide. So are you guys using food labels at all? Have you ever played around with that? That could be a really great activity, again, that would keep them engaged. Hi there, there you go, mute your line there. So using food labels can be a great way to count carbohydrates or calories and to educate them on the foods they're using. So they could bring in some of the food items that they have from their home, or if you're doing a phone consult, have them go into their pantry and pull out a couple of items that they eat all the time. Oh, I always eat this rice. Well, let's go look and see on the label, what is it? And you can actually, you know, go through some of those simple things over the phone. You know, again, kind of that kinesthetic learning where people have their hands busy and they're using their hands and moving. They're not just sitting there. Might be a way too that keeps them engaged and will make it enjoyable for them. All right, next slide. Going back to that support process, we have a wonderful program with NDPP, and we have classes now that are getting through Utah. And so I provided the phone number. It's a hotline or helpline number, excuse me, and they can register the class. And there's also the website where you can enter in your zip code and your location of how far they're willing to travel, and it will come up with the classes that are available. And the fun thing is here that this is a longer term commitment of many weeks, and it's been a very effective program. And the fee is $250 and is waived if the person has income eligibilities or is on Medicaid. So that's a really great thing that we've been wanting to promote, and we're finding that some of these fees are also waived for other populations. So they're working on that right now. We're working on that to try to expand this program. So if you have any that would be considered for diabetes or pre-diabetes, this would be a great resource to use. Okay, next slide. I wanted to talk a little bit about green prescription. This is kind of a newer concept, and I'm just starting to learn about it in this role that I've been asked to take on. And basically, it's a nationwide effort that is connecting healthcare providers into their communities through their patients. So your healthcare provider will write a prescription, and it might be, say, for fruits and vegetables. And that is a simple, low-cost way of having an intervention. And it's kind of tricky and catchy. So the patient leaves the physician's office with a prescription for fruits and vegetables. They go into their grocery store, who I'm working with on the corporate level, and hopefully they will have a discount or a incentive or something for them to come in and get their fruits and vegetables at a lower cost. So then the grocer wins, the patient wins, and the physician wins because they've got the compliancy. So it's this great way of introducing different facets into the community to help patients with their goals. So we're calling it Green Prescription, and so if they're going in for their own pharmacy needs into their grocery store, they can fill their prescription for their fruits and vegetables. So sometimes these breakthroughs are not because of like fantastic medical or technological breakthroughs, but something as very simple as a piece of paper with a physician's endorsement and using that clout to try to get the patient motivated. So what I'm asking is, when this starts to come through, we would love for you to support this program and maybe help advertise it. And your patients might be, some of these that are receiving this in the community through their physicians. And any access you have to your physician groups would like to share this concept with them. So look forward to this. Next slide. And we're doing this with physical activity as well. So we're hoping this gets off the ground. And again, the partnerships here for physical activity might be the Parks and Recreation or a local gym or some other venue that would accommodate a little perk for them. So pretty cool, huh? Okay, next slide. So remember a couple of tips here on remembering here as we're wrapping up this little session here is when you're going through this process of counseling, remember that it really has to be a joint effort. So using a guided or decision-making process is going to be more effective when you're working with your patients than coming up with the goals yourself. And I'm sure you're already doing this, but try to use that three-step approach to think about asking them, where they are in this process. Where, what do you think you want to focus on? Ask them what, they would like to make as changes or goals, and find out what ideas they have, and then build off of that. So you can always go back through that same process of redirecting them when you're asking them questions and kind of helping guide them or redirect them into what they really need to be doing if what they're proposing is not feasible or doable or too lofty or too easy. So, but keep in mind that it has to be a joint effort. So if you're making a meal plan and they're saying, something about, what they're planning on doing, help guide that into something that's concrete and objectable, measurable. And a couple other things to remember is when we're working with obesity issues, we want to make sure that we're not using those words. They're not as friendly. So if we're using fat or obesity, it's a lot nicer to use words like weight or excess weight. They'll be more effective and more friendly. So keep in mind some of those tips. And also, when you're focusing on behavior or on these goal-setting activities, focus on behavior instead of just making a statement like, okay, let's lose 10 pounds, or you need to lose 10 pounds, or how do you feel about losing 10 pounds? Focus on the behavior itself. For example, going back to eating more fruits and vegetables or incorporating more exercise. That gives them more control and more power to feel like they have an action plan. We often say to children, don't do that, but they don't know what to do in place of it, so they're going to get fidgety and get into trouble. So we need to give them direction. Here, how about doing this? Hey, would you like to do this or this? So when we're setting these goals, think about the focus to be on the behavior versus on not what to not do, but the opposite, what to do. So that will build up their confidence and build in some accountability as well. So, okay, next slide. So can't get away from talking about vegetables and fruits. So we know that including this diet or daily intake reduces the risk of heart disease, stroke, and cancers, and helps manage weight. And it's just really a fantastic thing for anyone to expand and improve their diet on. We want to make sure that we focus on the positive aspects of eating fruits and vegetables rather than focusing on the negative health risks of not eating well. So the benefit to eating fruits and vegetables are X, Y, and Z. You have that information. So focus on that, the positive aspects, as opposed to the negative health risks of not eating. If you're not eating this, you're going to get this, this, this. That's not as effective. So keep that in mind. That's another little tip when you're speaking to them. And remember, all kinds of fruits and vegetables are in all forms are great. Fresh, of course, is probably the best tasting and best or most well received. But the reality is, frozen is fine as well for having convenient access. And if we're going into canned items as another option, that's great. Remember to talk to them about not adding or not having canned products that have added sugar for the fruits or added sodium for the vegetables. So those are just some things to kind of remember as well. So again, when you're counseling, try to start from a point that they are coming from. Start from where they're at currently and work forward from that point. So maybe you'll have a client that doesn't eat any fruit at all. So in that case, you know, you might want to just ask, well, are there any fruits that you like at all? Or are there any fruits that you're willing to try? And then come up with, you know, some strategies about how we can get that into, help them get that into their daily intake, or, you know, a one-time opportunity to try it and see how that works. And then follow back up with them. Don't forget to make your notes there that if you have these goals set, to follow back up with them on those goals so that you feel like you're building in that accountability. And if you have a positive rapport and relationship established with them, then they will feel that that follow-up is of support and not of judgment or of a punitive approach. So, okay, next slide. The National Institutes of Health is a great resource. I love some of the materials they have. You could start playing around with looking on the websites there. They're done well, they're simple, they're colorful. And this one is choosing foods for your family when you're doing grocery shopping and having easy access to those foods. Sometimes just having the right foods in the home is more important than we think. Okay, next slide. Another strategy might be to involve the whole family. If you're working with a population that have grandchildren, this might be a way to motivate them that, number one, they're going to be around longer to enjoy their grandchildren or their great-grandchildren. And number two, you know, if they're empowered and start learning these things, they can bring it back to their family, and they can be seen as a role model by teaching their children and their children's children. So that's another empowering process, and you know, might be motivation to them. So again, think about where they're coming from, what their interests are, and you know, what is the thing that turns them on? What's the motivating piece that turns them on? It could be an event that they're going to a wedding in spring and they want to start taking care of themselves, looking better. You know, these are simple strategies. So, you know, whatever it is that works them towards a lifestyle change. We don't want to do tricks of dieting or anything that's obviously, you know, not evidence-based, but look at what are the things that are going to motivate them and then build from there. So there's some really good information from this website on some of these activities. And the next slide, please. I like this one because it has a nice visual of packing lunch, and this might speak to a grandchild's lunch rather, and you know, they can help in that process, and that will reinforce again their own behavior of selecting foods. You know, teachers learn twice, so when we teach, we learn again. So. Okay, next slide. This is the last point I wanted to make about some clinical information that I just learned last month, and this is just really fascinating to me. So the information I learned, well, you probably already know a little bit about the controversy of what's been happening to our nation over the last several decades. And what we've done is focused on fat as being the culprit in cardiovascular disease. What we're finding out, and you probably have heard about this already, is that sugar also contributes. I didn't understand the mechanism or why, so I've looked into this a little bit more, and this is just a really key piece for me to understand that, you know, what we're finding and what the research is now showing us is that sugar contributes to atherosclerosis by changing the actual particle size of the LDL, the low-density lipoprotein. So that was just amazing to me that a school of thought has really changed that the smaller particle LDLs are more dangerous than the larger particle LDLs because they're more permeable to the vascular endothelium and are oxidized more easily. So what we're understanding now from the information we're getting right now is that these smaller particle LDLs are really getting into the, permeating into the vascular system and causing the atherosclerosis. And so this is, very, very significant that we have to look on how we're counseling. It's not just a soda pop and we're looking at calories, but now we're looking at more heart disease, and this is just really, really important. So, so what this study found was that 130 grams of fructose increased the amount of small, low-density lipoprotein particles. So we need to look at putting some glasses on this area to understand that this is affecting them in a more profound way. So this study showed that if greater than 10% of calories are sugar, there's an increased risk of mortality from this phenomena happening. And if the intake is greater than 10%, between 10% and under 25%, the risk is 30% greater. And if it's over 25% from intake from sugar, that the risk is 175% greater. That's crazy. Now I'm sure we're going to find out more information about this, but and 25% of your caloric intake being from added sugar is very, very high. But it does show you that there's a correlation here, or a direct causation. I shouldn't say correlation. So I thought this was really fascinating. So the next slide, please. So I tried to boil down some of this information into really 2 slides. And so this slide here is basically saying that what we were doing before was replacing fats or eliminating fats in our diet, but we did that by replacing it with carbohydrates and processed foods. And what we've done is we shot ourselves in the foot, and we've increased the risk for coronary heart disease. And so looking through all of the data over the last 30, 40 years from this researcher that I attended the conference on and have spoken with him a couple of times, he came down to this synopsis of what really affects cardiovascular disease or coronary heart disease. So fats that are saturated by themselves have no effect. So this is really a departure from what we have all been taught, and you'll have more information, I'm sure, in the next year or so to help you process this, like I'm processing this as well. So if we replace saturated fats with polyunsaturated or monounsaturated fatty acids, we have less effect on cardiovascular disease with men. That's what the study showed there, so that's targeting men. The seafood and the omega-3 fatty acids that we ingest, we know that it has less risk of disease, so that's great. Dairy foods, they have been a culprit too, that have been said to not do the fats in the dairy foods. Well, they're finding that there's no effect, excuse me, they're not detrimental effects, so you do have less risk of disease when you have dairy foods. Eggs, we've been told to have those in moderation. There's not an effect that they're finding. Nuts and seeds, also another great food to incorporate. It has less risk of disease. So nuts and seeds are fantastic to incorporate, and you never see anything bad written about nuts or seeds. Red meats, you've probably heard that the last couple of months in the news and the media, and there is an effect to increase the risk of heart disease. And the culprit has also been to the processed red meats. So those are the 2 areas that you probably have heard a little bit in the news, and those are the ones that we want to focus on avoiding it on an ongoing basis of intake. So that's the take-home message right there. That's a good little table to focus on and emphasize on when you're talking to your counseling. And going back to the Whole Foods. Whole Foods gets you out of a lot of trouble with some of the sugar foods and some of the refined carbohydrates. So that I wanted to end with was the most important information that I had learned in the last couple of months. So, okay, next slide. I just wanted to mention one other aspect of my job that I do in work sites. So this doesn't speak to your counseling with your clients as much, but I wanted you to be aware that, you know, most health educators have an interest in being healthy themselves, and as we learn, we apply it in our own lives. And I think that's why I got into nutrition, is because I wanted to be healthy and I had an interest in it. So honestly, I had never really thought about the access to water in my work site. I mean, I always brought water, but these are things that I'm focusing on in the state of Utah to help people have access to potable water. So if it's in the Parks and Recreation or if it's in your own building, we installed these 2 water systems, this gray image of the water station, where you can use a refillable bottle versus, you know, adding plastic bottles to landfills, but also to have easy access that's filtered water. So, you know, maybe you haven't thought about that. We have found that it has saved us a tremendous amount of money because we were using bottled water systems, bringing them in. So the installation costs were far lower than our ongoing monthly bills of receiving bottled water. Beverage standards. You know, I know some entities that actually have access to free soda during the day, and I think that's a very poor practice, and I think that could be something that as a health educator you could bring it to your institution, or, you know, if that was happening, or if you're working with anyone else in the community. You know, it takes a village to really make this happen, and, you know, you may not have thought about it. I certainly have not thought about the group gathering policies until I started working in an area that had staff meetings regularly, and then they were doing these holiday parties, and we would have parties that there would be more desserts than there would be the entrees. And so, you know, in our building, the Department of Health, we have a group gathering policy so that, you know, the desserts have to be, you know, smaller. We don't have we don't have this imbalance with what we're doing to create an environment that is unhealthy for, you know, ourselves and our coworkers. So it's kind of like you know, walking the talk. So vending machines. We have a second vending machine in our building. We haven't taken away the snacky foods, but we've added a second vending machine in our building, and that vending machine has nuts and seeds and granola bars and juices and things that are a little bit more healthy, cheeses, yogurts, different things like that, versus just the standard really junk food. So anyway, if you have any interest in these areas, I'm happy to help you in that process with developing workplace policies, and you know, thinking about how that can help you in your own life, as well as you know, help other people. So the last slide, I wanted to just ask you once again, how do you feel now if you answer that question again? Do you think you can make a difference in a person's life? Has this at all motivated you or regenerated your interest in doing some different counseling techniques? And how do you feel you can score? You can look at your own paper and say, well, you know, I maybe feel a little bit better about having some more tools and having resources to do my job. So hopefully you've scored a 1 or 2 numbers higher from what you did earlier. So, and that's all I have. I have the next slide is just references, and as I said, I'm going to give Stephanie some other materials and to share with you so that you can you know, play around with those, and hope you have a good time with it. So thanks a lot for your time. Happy holidays, happy and healthy holidays to everyone. It's yours, Stephanie.
Did anyone have any questions before I close it? It doesn't sound like it. If you have any questions, you can email me specifically, and I can get them to Judy, or I can answer them as well.
Yeah.
I just kind of wanted to close unless you had anything else, Judy.
Oh, thank you so much. Just wishing everyone a happy and healthy holiday and New Year. Thank you.
Okay, perfect. I think just the overarching message was just to try and make it a positive and motivating experience for the client so that they can invest in what you're telling them, and also in the behavior change. One of the things that I did notice as I've been going around with some of the clinics is I've been seeing a lot of great things, but one thing that maybe needs to be emphasized is when the clients are setting up goals, make sure that they're setting reachable goals or healthy goals. I did have one client that I don't know, I think as women, I think we're a little harder on ourselves, and they immediately brought up, well, I need to lose 30 pounds, like this is ridiculous. And they just it all of a sudden turned the session into a negative experience. Did she need to lose the weight? Sure, but I don't think that she was setting herself up. She's like, I'm going to lose it in a month and a half or 2 months or something like that. So I just don't think that it already like set a negative tone for the session. She wanted to change it, but she left there maybe a little down. So taking what Judy was saying and making it a positive experience and getting them motivated and being supportive for them and implementing the empathy piece that she brought in, turn it to a positive and just help set them up for goals that they can reach that are a little more reasonable and attainable. I think that would help with our clients investing and also their willingness to change. So just a couple of things, make sure to focus in on their willingness, help them come up with ideas that are going to be specific to them and offer them different options. She gave you a lot of resources on where you can access some new and different ideas to try and diversify your coaching technique a little better. And just take the time and focus in on the client so that you can personalize their sessions so that you can relate to them. And they might not be ready to make some of the changes, but even if they're there and they feel like it's a positive experience, some progress is being made, and progress is a step in the right direction. So if they're feeling like this is a worthwhile experience, maybe they'll be more likely to invest in their changes, maybe more receptive to your follow-ups that are being done, which can create a returning client that's going to come back the next year, and hopefully that they will share it with people that they know so that we can increase the number of clients that are coming in. So I will send out the information that Judy talked about, but if you have any questions, just let me know. And thanks for participating today.
Thank you.